Good morning, everyone. Today I'm doing a tummy tuck and a pubic lift on a young mom of 4, and she's in fantastic shape. It's just that post-pregnancy she has loosening of her abdominal wall, abdominal muscle separation, excess loose skin of her abdomen as well as the mons, and her abdominal muscles pulled apart so much she actually has a large umbilical hernia that will be repaired with one of my general surgery colleagues as part of the surgery. So the surgery today will repair her abdominal wall muscles, tighten and strengthen her abdominal wall, remove and tighten excess skin of her abdomen and her mons, and it's gonna make such a huge difference for her. I'm super excited. So I've started by filling the patient's abdomen with tumescent, which comprises of numbing solution as well as epinephrine to shrink the blood vessels. And you can see here I've delineated a low tummy tuck incision that's in her pubic hairline. And now I'm going to make the incision. And you can see how this is just a really nice gentle curve. This creates the most natural incision. If you look at most people's abdomen, they already have a nice crease in this area. And it's also the easiest to be hidden underneath an underwear or a bikini. I very carefully elevated all the tissues off her abdominal wall, and you can see here what a wide separation she has, and just to see how loose her abdominal wall is. So now I'm going to measure. I've carefully measured how much abdominal wall tightening I can perform, and you can see at the widest point it measures about 6.5 centimeters. And also you can see her belly button is off center, so I'm going to try to adjust that a little bit to bring it more over to the middle. And you can see that with this tightening I'll be able to repair her abdominal muscles and tighten her abdominal wall. Look how nice that will be. Completed the muscle tightening of the upper abdomen. Look how nice and tight that is, especially when you compare it to the bottom. So you can just see what a big difference these sutures do in order to strengthen the abdominal wall. See the difference? Now, I just wanted to show beautiful, even 2-layer muscle repair. Look how perfectly lined up that is. There's no bunching, because even though this is on the inside, I think it's important to still make it as perfect as possible. And now I'm placing long-acting numbing medicine all underneath the muscle repair, so my patient will have little to no pain after surgery. And most of my patients just take Tylenol. They don't require any prescription pain medication after surgery, just with a very gentle technique, quick recovery. Okay, so now I've carefully measured how much skin and fat I can remove, and now we'll measure and weigh the flap. So the flap measures about 11 inches, which is equivalent to 28 centimeters. And now we'll look at the flap closely. You can see that the skin that I removed here is very wrinkly and stretched out from her multiple pregnancies. So all this skin that was bothering her will now be removed with the specimen. And I just wanted to show the layers of the abdomen. You can see here's the skin, the dermis, superficial fat, fascia that I've marked, and deep fat. See how nicely you can see that? Now I'll weigh the flap. It's very light. It only weighs 1 pound and 7 ounces, so about 1.5 pounds. That is equivalent to 678 grams. Awesome. Okay, so now I'm getting hemostasis, making sure that there's nothing bleeding, and you can see that through this entire case she's had pretty much little to no bleeding, but just getting any tiny little vessels. So with my gentle technique, you can see there's little to no bleeding, patients have a quick recovery, and overall they just do amazingly well. Now I'm just using suture to find her exact midline so I can make sure her belly button is super centered. Awesome, thank you. Now I've delineated the lateral border of her ab muscles, and I'm going to place the contouring sutures to tack down the flap and create the appearance of abs. Now I'm closing the incision from deep to superficial, and it's really important to do a meticulous and careful closure where the top of the flap and the bottom line up perfectly to create the best possible scar. And I'm closing it over a drain. A lot of you have asked me if I use drains. There is a drain here, and I think that drains are extremely important to prevent fluid collections or seromas to make the best possible result. And usually the drains come out pretty quickly, but they are essential because if there is a fluid pocket that collects, then it makes it so there's not as nice of a contour, and also doctors may have to go in with a needle and drain it. And so just having a drain in for a few days eliminates that complication. And most patients, like I said, don't mind the drains. They'd much rather have a drain than have a needle put in them after surgery. So now I'm doing the deep dermal suture, which is the layer just under the skin. And you can see that when I place this suture, it brings the skin edge together. And each layer just brings the skin edge closer and closer together. And you can see that there's no tension on the skin. Look how nicely and easily this comes together, see? And the less tension there is, also the nicer and thinner the incision line. So all these little details in the surgery are just really critical to create the best scar possible. Okay, so now I'm doing the subcuticular stitch, which is the skin layer. And this is just bringing the incision and making it even more invisible. See how that makes it look super thin? Okay, so I just want to show the final result. Beautiful, flat abdomen. Look how incredible that looks. And now we'll compare it with the before. Okay, and now we'll compare it with the before. Look what a significant improvement that is. All the loose skin is gone. Her abdominal wall is nice and tight. She has a beautiful, natural abdominal contour. Okay, now look at the 3/4 view. Look how beautiful, flat, and contoured and natural looking her abdomen is. Okay, and then close-up of the belly button. You can see beautiful oval innie, and she had such a huge hernia. Look at what a dramatic result that is. She has nice abdominal contouring. Looks amazing.